Arganissima, New York. Your exotic skin, hair, and beauty source, and your one-stop shop for all your natural and organic skin and hair care, featuring authentic organic Moroccan oil and prickly pear seed oil and much more. Bringing you only the best, straight from the source and proudly produced in the USA. So what are you waiting for? Shop today at www.arganissima.com. Arganissima, New York. Your beauty is our duty. Arganissima, New York.
Welcome back to the iHealth channel, iHealth Radio, with your host, Hurricane H. New day, new show, new topic, new guest. And, we've had a lot of different guests with different backgrounds. And I didn't have a lot of MDs over the last 2 years and a lot of, primary doctors or specialty medicine doctors. And today I have one, with me who does a lot of things. And she's going to introduce us to a few items that, in the world of medicine, that some of the concepts are new, some of the concepts are really real, and we want to hear about them. Also, some of her project that she's, working with. And ultimately, she's also an author and writer, and she has a book, cooking right now. So we'll talk about that. So with me, without any further ado, as I try to be always suspicious and people are like, what is he talking about? What's going on? And also suspenseful. So today, I'll limit the suspense. So with me is Dr. Cheryl BryantBruce. And she is an MD. She's an award winner. I mean, she's a writer, as I said, everything, all what you can think about. Been around and, has her own practice, different, part of different organizations. So Cheryl, how are you today? Welcome to the show.
I am doing well and so excited to be here. This is a wonderful show. I've been watching a lot of your episodes and top notch. So I'm honored to be here with you.
The honor is mine, and thank you. I mean, I feel good about that. coming from someone with your expertise and your weight, I mean, I'll take it. I'll take all the credit. Thank you so much. Thank you. So doctor, let's first, introduce you to. I mean, I never do justice to my guests, unless you would do the best, presentation on your behalf in terms of your bio and your expertise and experience and your practice. So let's talk about your journey. Where you started in terms of medicine, where you are today, and let's talk about the concepts that we want to share with the folks.
Okay, well, I am Dr. Cheryl, MD, also known as the Celebrity Doc. I am listed on Time Magazine's 100 Most Influential People in the World for bringing back the house call. I started my medical career a long time ago. Over 30 years ago. At the time when I started, I went to a traditional medical school. I went to Tufts in Boston, which was a traditional medical training, and was in keeping with the disease management paradigm that we know our healthcare system, for the most part, to be. Tufts was a little bit more progressive at that time than a lot of other schools, and that it did have a strong focus on family medicine and prevention. Even still, I was way ahead of my time because I had grown up out of country, so I had been exposed to a lot of different healthcare paradigms, and I knew that there were a lot of different ways of managing different things. So I started out straight out of the gate with a very holistic and integrative approach. And when I say an integrative approach, what that means is that I used a multitude of modalities, whether it was homeopathy or essential oils. And obviously this was before these things all came into vogue and became popular. My patients knew when they ran into each other in the grocery store, because at that time the entire population was much younger, and so people had a lot of little babies, so they would run into each other in the grocery store, and they knew that they were Dr. Cheryl's patients because they would be in the spice aisle, in the baking aisle, examining the vanilla extract, trying to decide which one was the best one to use. And they would ask each other, well, what do you think about this vanilla extract? Well, what are you going to make with it? Oh no, I'm using it for the gum pain for my teething babies. So they all knew that when they talked about the vanilla extract and the gum pain, oh, you must be one of Dr. Cheryl's patients. And my patients, for the most part, knew that if it was possible, I was going to use something natural, something holistic, something that they probably could find right there in their own homes, that I was very likely to change their diets as a way of managing their care, that I was guaranteed to get them moving as a way of managing many of their problems, whether it was in insomnia or poor digestion, any number of things. Fitness, movement can actually aid in improving by getting the oxygen flowing, the blood pumping and clearing toxins out of the body and such. So I came through the system with this kind of mentality at a time when it wasn't a popular thing to do. And my colleagues kind of looked at me with a side eye. I was a little bit of a strange bird. And I mean, the words quack came up, and people were like, well, you can't possibly be a real doctor. Real doctors give a pill. And I gave pills when needed. Traditional medication has its place. And there are lots of different kinds of modalities of healthcare out there now. And the more naturopathic are warring with the traditional, but there's a place for both. And everybody needs to know what their lane is, so they're not overstepping and not outside of their expertise. Because there are times when I'm going to stay as natural as possible in the management of my patients. But then there are times when I just have to say, hey, we've exhausted what we can do naturally. And now it's time that we have to turn to pharmaceuticals, or now it's time that we have to turn to surgery, because not everything can be healed naturally.
Well, doctor, first of all, thank you for that brief but concise and comprehensive overview. Well, you really, in that little moment, you've covered a lot of grounds, and I'd like to take a minute on each one of those areas to just discuss. Now, first thing first, I mean, you said it. You started talking 30 years ago. The world of medicine was a little more not traditional medicine. Basically, you go to the doctor, the doctor prescribes, stuff, and you take the pills and you're good to go. Yes. So you decided to go in a whole different route, in parallel to the traditional medicine. Now, here, the word traditional medicine here can be a little funny, because traditional medicine will be really the holistic version of old medicine, but really standardized medicine, I would call it. Yes. At least that's how the system, would probably refer to it. And so you were a standard MD, but you chose different. You chose the alternative in addition to the standards. Yes. And ultimately, I'm sure that was, like you said, the word quack and probably other, words were thrown in the mix. And people are looking at you.
Because you have to remember too, that I was still coming through at a time when female physicians were not the norm, and African-American physicians were truly the outlier. So I had a whole lot of things going on in there.
Well, I was going to ask those questions, but I guess you hit them. So there's that. I mean, there's the female status, there's the African-American status, and there is, we're talking 30 years ago. And, yes. and again, we're still struggling with some of that stuff today. But
yes, we are.
Overall,
yes, we are.
But certainly going back to the time, it was really in your face. I mean, there's different double standards in a lot of practice, right?
Oh yeah.
But first of all, congrats, because you did well and you made it, and you made it.
I survived.
You made it to the 100. World renowned. Folks on magazine. So that's an achievement. I'm sure there's plenty of achievements, and you can enumerate all of them. But that was the first challenge. Just being who you were at the time where you were to make the difference, and then you just basically kind of just become more crazier for them by throwing in this whole, left, field, experiment on well, wait a minute, you guys do this, I want to do this plus. Okay.
Right.
Now that's a challenge. And, obviously you did it, and
Right.
so
Right.
you mentioned through that discussion also the concept of preventative,
Yes.
holistic, natural
Yes.
medicine. And you covered like something about vanilla extract. I mean, who would have known vanilla extract would be used for something like that, right?
Right. And
And-
people just kind of roll their eyes, but when you actually think about the science of it, it makes sense because vanilla extract is an ether. And what do we use ethers for? Anesthesia.
Excellent. Well, listen, I mean, it makes sense when you hear it, when you see it broken down, but
Yeah.
just as ad hoc, you're not going to put one and one together, right? So,
Yes.
so I'm just kind of highlighting the points right now, and then we'll dive through them. So then you talked about the concept of, home doctors, and we'll dive into that. So home doctors, again, talking about traditional. That used to be the norm. You didn't
That
go,
was the norm. That was the
you're
norm.
sick, you call a doctor, the doctor shows up with a briefcase and they do all the work. And unless there is something that's needed in a hospital, you get your treatment there. That was back in the days how it was standardized. And believe it or not, in
Right.
some parts of the world today, that's still the case.
Right. Oh, yeah. Yeah.
So-
And I
so
mean,
that-
it was like there came a point where we advanced, but we didn't necessarily advance in a way that was necessarily best for the individual. I mean, we came out of the house calls and we went into the institutions. Mothers left breastfeeding and went to bottle feeding. So we went away from what was natural. We went away from what was high touch, and we became very industrialized and technical.
Well, so let's talk just about that point since you're highlighting.
Mhm.
Why? I mean, people may know the answer or they may not. But,
Yes.
but in your experience, what was that? What was the reason? I mean, it's certainly when you hear it like breastfeeding, that's good.
Mhm.
That's better than bottle and formula, right?
Yes, yes.
Being at home in the comfort zone and getting your services. I mean, listen, we experienced something unique in the pandemic in the last 2 years where people now are doing telemedicine, which is
Yes.
basically home on Zoom.
Yes,
you know,
exactly.
but so it turns out to be a good thing. But at the time, you're right. It was a transition to like institution. So, and I know
Mhm.
like a lot of care models or healthcare models were based at a facility. That's
Right.
where your primary care is, specialty, everything. And it, God forbid,
Yes.
need any surgery, they just bounce you right up. You go to the emergency room,
Yes.
you go up to the floors, right?
Yes, yes.
And that's still an effect. But
Mhm.
now we're revisiting the concepts that were there before. So we have a little bit
Yes.
of a choice. And I'll give you some
Yes.
experiences of mine in this particular world, as far as the home visiting doctor versus the physicians at our facilities.
Right.
Through the insurance, scope, right? But so,
Oh, yes.
so why was there that transition? Was it industry, money, pharmaceutical driven? What was the driver? Is it just pure capitalism?
All
All
of
of the above?
all of the above. All of the above. I mean, it was at a period when we were industrializing rapidly. Technical skills were rising, and this was progress. It was the wave of the future, and everybody wanted to be on the cutting edge. So those things, natural and home-based and kind of grassroots, became archaic in a sense. And so if you weren't having the baby in the hospital, then it was like you might as well have been having it out in the field. If you weren't using formula, then it was looked down upon. I mean, even I nursed all of my children, and I wanted to have a home birth because when I grew up in the UK, the lady that lived down the road from me had a home birth with twins, and I was very young at the time, but I thought it was the most beautiful thing that I had ever seen. And it just seemed so natural and organic. It made sense to me. It also made sense to breastfeed the babies. And I remember when I was very, very young, I read a lot, and there was an article in Mother Jugs and Speed that was there because I was that weird kid that read that kind of stuff. And there was an article about mothers in Africa who were being given this formula, but they didn't have the hot water and the sanitation to safely give it to the babies. So the babies were getting dysentery and everything. And in my young mind, it made complete sense that it was smarter to feed the mothers and let the mothers feed the babies than to keep dropping this formula that was making these babies sick. So I wrote an editorial in, and they weren't real happy with me about that. But
you were a rebel, doctor.
Yeah, I was. I always have been. My dad said I was born an old soul, and I remember sitting, crying when I was 5 and 6 years old because those infomercials would come on, and I would be crying over the starving children in Biafra. And then the next day I went out with my tin can to collect money for them so that I could feed them. Wow. So I was that kid. I carried the weight of the world on my shoulders, and from as long as I can remember, wanted to make it a better place, wanted to heal the suffering that I saw in the world.
And I'm pretty sure you've done a lot of it, and we'll talk about more of that in short. But you talked about an example, breastfeeding, birth home. Yeah, I think there's probably a good reason, because I mean, society has evolved into like this modern world where feeding your children in the street, it's not really cosmetically, aesthetically, appealing. So, back in the days, it was common to see that. I mean, ladies will turn and do what they have to do, and that was it. And men look the other way. It was different.
Yeah.
So
it's interesting though, because we are returning back to those things, because we're looking at them and we're seeing that it is beneficial to the health, that the babies who are breastfed do significantly better than the children who are bottle fed. And home births have come back into vogue. Doulas are a very big thing now. And, house calls are coming back in, and I helped make that happen.
Well, we'll get there. But again, you're right. You're talking about, it has been a lot of studies, have been out there to prove there's nothing better than breast milk compared to formula. That is a chemical, piece, right?
Right.
Also, the 2 years, of breastfeeding, there's a driver behind it. There's, some real, evidence that it's better and healthier.
Yeah, I think children are healthier. They have less allergies. They have fewer colds. They have fewer ear infections. So they get a much better start.
Well, they're basically essentially, they got all the nutrients that they need that are around them, that they will grow up with. In the formula, there is some stuff, but not everything, and so therefore that's limited. And listen, I've seen that, and we notice that today a lot of children have problems with their teeth, where eyesight, with other, to your point, allergies that we didn't hear about a couple of years, a couple of decades back, and that's just very common. But then also you talked about home birth, right? That I think. One of probably the reasons why people were, I guess, seeing that that's not any more civilized is because of the mortality rate, the infant, infants, dying, or even the mothers may have the sanitary, levels and things like that. I mean, that was something you would see in a third world country. So obviously we're, in the front, level of the countries in the Western world, and therefore we have to be more, advanced. And so hospitals come through. Also, it's a business.
That was the thought.
Well, there's also a business opportunity, so you make more money if someone is in the hospital, right?
Yes.
So there's nothing wrong with business and capitalism making money, right?
Right.
But again, it has.
But then when you look at the toll that takes on females, under circumstances where a woman is close enough to a hospital, that if she has a complication, she can get there quickly. Women do much better with parturition or childbirth when they do use a doula, and they have a much lower rate of cesarean sections. This is supposed to be a country with one of the better health systems, and yet we have one of the highest rates of C-sections. We have one of the highest rates of hysterectomy. And that's because there are unnecessary procedures being done on women in particular. And the precautions to help a woman take care of her body in an appropriate way, and even to spend the time necessary to prevent things like episiotomies, by massaging a woman, you can prevent episiotomies. And there were lots of complications from episiotomies, and some of them were very, very bad complications that a woman had to deal with for the rest of her life. So we have done a better job recently of looking at things and saying, well, this is very convenient and it's very aesthetic and all of that, but is it best for the woman? Is it best for the child? And starting to answer that. And I think that part of that is women coming into the medical arena and saying, hey, our bodies, our choices, and we don't want to be brutalized in these ways. There are better ways. So I think that, a balance is coming into play. Again, just as I talked about the natural and the traditional having to work together and everybody knowing when to stay in their lanes, seeing the same thing happening where you're getting a balance where natural births are encouraged and C-sections aren't occurring as frequently, and doulas are being used and working hand in hand with OBGYNs. So you're seeing balance. I think that healthcare really pretty broken in this country, and it was, in some ways it's bottoming out, in some ways it's still going that way. But we're starting to get innovative in the way that we're thinking about things, and we're starting to look backwards at what worked in the past, because some of what worked in the past is very useful for the times that we're living in. And then we're taking the technical knowledge and creating better ways to do the things that have previously worked in the past.
Well, true. Well, if you look at just talking about birthing and things like that, I mean, like my first kid, was born 25 years ago. My second kid was born 16 years ago. And between the time, everything has changed already. So for example, the first one was delivered in literally a surgery room type.
Yes.
It was really like you felt like you're in the surgery,
Yes.
The second one was in a very comfortable living room style, and all of a sudden it transformed into the surgery room. So they took those concepts and applied them in a clinical setting. But again, ultimately there's a financial piece to that, and so
of course there is. Of course there is.
Listen, I mean, there's nothing. I mean, it's medicine is got a purpose, but it's also there's business behind it, and especially hospitals are not, they don't just exist with no funding, right? So certainly there's that. I mean, I'm an insurer in my career, and we deal about with that all the time, and we understand. But there's also trends that were in place. So talking about C-sections and cesarean, I can tell you a true experience. When my wife was pregnant with the second kid, the first OB doctor was 100% C-section. That's it. You go to this doctor, you get a C-section. There's no like, no, even though it's your first kid, doesn't matter. Your second kid, you're still getting one.
Right.
We had a friend and she says, no, I have a different doctor. Try this guy. Guess what? That doctor, no C-section, everything was normal. So, but then we realized that there was a fee that is paid, that is higher rates. And so I as an insurance person, we look at those things.
Right. Exactly.
Cost is important to us because we pay, right? So just looking at it from my business world, I'm like, wait a minute, not even looking at it from the health, piece of it. I mean, the aesthetic, it's not a cool cut, despite you try to make it as good as clean. And there's risk for surgery. Any surgery has risk, blood clots, anesthesia. So ultimately, there's nothing better than natural. So again, I mean, we're talking about integrative, and all this longevity and all holistic, but I think it's all linked here. So you're right. There is a little bit of a return to the standard, or the more traditional. And I can give you an experience also. So I worked for a company that had the medical center models. And so
Right.
if you wanted to get, care, you had to go to these centers. That's it.
Yes.
So we were the insurer, and anyone that is a member with us will be only going to this. And there's some models today
Right.
in
Right.
California,
Yep. They
Casa
still
Permanente,
exist.
exactly.
They still exist.
So
Yes.
that's a big one. But then eventually companies started diversifying.
Mhm.
So now you have two options. You can go to a medical, a one-stop shop clinic, which is common to a degree, and sometimes it's convenient because you
It's
can do all your
convenient for
stuff.
a lot of people.
Exactly. You
Mhm.
come in, you do your specialist, your lab, your all stuff, and you leave one trip.
Yeah, particularly if you're low income and you don't
Yes.
have easy access to transportation, you need to be able to do as much as possible in one place. So it does work conveniently for them, and it does ensure that they get more comprehensive healthcare than they otherwise might.
And they do. I mean, to be honest with you, like I like it to a degree because you
Mhm.
will go in, you get your primary visit, you go next, you go to the lab if you need to do something there. If
Mhm.
you need a specialty, you can make appointments, and they're back to back.
Yeah, it's easy.
Sometimes
Mhm.
they even pharmacy is there, so you collect your
Mhm.
stuff and you leave and you're done. One trip and
Yes.
that's it. So there was
Mhm.
that convenience. Seniors, I'm in the senior, market, so therefore
Mhm.
that comes in very handy in terms of solution. But
Mhm.
then there are people that don't want to do that. They want to have their
Right.
own doctor in the community that they've been going to, and they like that.
Yes.
And that was the
Yes.
second model. Then in more recent years, we're talking about house call doctors.
Right.
And that became also a sexy trend, in the insurance world for us. I say,
Yes.
hey, do you there's rain, there's snow, especially for the senior, folks. I'm like, do you want to go to the clinic and wait on the cold and it's freezing, especially in New York? I mean, it's kind of
Right. Right.
It's either too hot in the summer or cold in the winter. So
Right.
what about if you can get a doctor home? Oh my God, you
Mhm.
can do that? Yeah, we can get you a doctor that can come and visit with you like all days. Oh,
Mhm.
and again, you're talking to a senior, that's something
Yeah,
they've
and that's
experienced.
really a big deal too, because a lot of times, I mean, I have seniors that would come into the office when I had an office-based practice, and they would come in carrying a sack of medications. And doing the insurance thing, you had a 15-minute time slot. Well, it took them 15 minutes to get the medications out of the bag,
Mhm.
because they certainly didn't know what those medications were. Well, I'm taking the pink pill and the yellow pill, and
We still do that. We still have them.
yeah, it was a nightmare. It was a nightmare.
Well, they carry all their stuff. I mean, and
Yes,
some of
and
these
that's a
folks
good
have
thing.
10.
I mean, that's really a good thing, because most of them do not remember what they're on or what it's for. So I would rather them come in with their shopping cart full of medications and being able to examine them. And on numerous occasions, I found that they would have 2 or 3 of the same type of medication, and they're taking them thinking that they're different medications because one's got the generic and one has the brand. Or like the ones who are in the Veterans Administration system, it's not uncommon for them to have several different doctors, and they may not all be speaking to each other, and they're sending the medications out on mail order. And I had one gentleman who was getting 4 of the same blood pressure medicine. And, fortunately, he looked at it and he was like, something's wrong with this picture. And let me call, my doctor, my concierge doctor, and ask about this. And so I went over to the house and I looked at the medications, and I thought, oh my gosh, if he had not been aware enough to say, wait, this doesn't feel right to me, had he taken all 4 of those medications at the same time, all the same thing, he probably wouldn't have been around, because it would have dropped out his blood pressure, it would have dropped out his heart rate. So he probably would not have made it.
Yeah, well, and again, that's the part where, listen, technology does help today. I mean, now everybody is in a database, and you can track the history. It's a little easier. And most of the hospital systems connect now, and obviously with their HIPAA rules, there's limitations to who can the access, but at least the information is available, and it helps. But you're right. I mean, for example, with the seniors, sometimes they also forget, and the kids are not there. They don't know which, listen, my mom is a senior, and I help her with her meds. And
Yes.
even I sometimes, I know all her meds, and I go to the doctor's like, oh, I forgot which one, how many
Right.
milligrams of this one, like, and the doctor sometimes changed the medicine because of whatever
Right.
reason, like she's diabetic, so they changed a little bit her shots,
Mhm.
and we've moved
Mhm.
from like regular Humulin to different, types of insulin,
Right.
from pens to no pens and all that, and therefore sometimes like I don't even know she has like 5 of them in the system. Like that's not the one, that's no
Yes.
more. Just this one is
Yes.
the one that she's taking. So
Yes.
it is, and for me, I'm involved in it, so I know formularies, I know a little bit about it. I'm not a pharmaceutical rep,
Mhm.
but I understand
Mhm.
these things. Some people
Right.
may not even know, and these names also are
Right.
very close, so it gets a little
Right.
tricky. But
Right.
I want to just to step back and go back to the concept.
Okay.
So ultimately this is all the whole discussion is amazing because we're touching on all core things that apply to preventative medicine, and the
Right.
goods, the pros and the cons, and and also the flexibility that's out there, and
Yes.
and how it can affect people's health one way or the other. And the good news is there are choices, I think, and that's I know our healthcare system is not the best, and that is still a question mark. I had the show before about like what would be a best model for healthcare, and I don't think
Right.
anybody has figured that formula now. Who's
Exactly.
paying for it, and so on and so
Exactly.
forth. I mean, the cost of it, all that
Yeah.
stuff is big.
There are pros and cons to all of them. There are pros and cons to all of them.
And also, I mean, doesn't matter what formula you do. I mean, there's a cost to it, and
Yes.
there's some you have to pay for the services one way or the other,
Exactly. I mean, you're either paying it out of your pocket or
or
you're paying
somebody's
it out
paying
of
for it,
your other pocket,
or
because
the
even if the
taxes.
government is paying for
That's
it, I mean,
right.
everyone talks about socialized medicine and
Mhm.
the Scandinavian countries having, this beautiful medical system, which they do. They, they walk in with whatever they have, they pay nothing.
But
If
it's
you're looking at it that way, but they have 50% taxes,
well, Canada
uh,
next door.
they're
Yeah.
happy to pay it. They're happy to pay it because it is buying them what they need and what they use.
Well, peace of mind is the first one. I mean, you
Right.
don't have to
And
worry
people,
about.
right. And people push back on taxes when they can't see what their tax money is buying them. But up in Canada and Norway, all of these places, they can see what their taxes are buying them. So they're happy to go ahead and pay them. But somebody has to pay.
True. And doctor, I don't want to get into the politics of it, but I wanted to highlight this item, which is the fact is, in the States, at least, there's 3 categories of people,
Mhm.
and
Mhm.
really it's based on your financials. You're either wealthy enough, and this will be the least of your concern. You can pick any doctor, and we'll talk about concierge
Right.
medicine at the
Right.
highest rate. You're middle class and you're working for a company, and your insurance rates are going year after year. And unfortunately, that's just how it goes because you have
Yes.
to pay for these costs. Everything is more expensive. Or you have
Right.
nothing, and now the government pays and you're cool. You don't have to worry about
Yes.
anything. But then your access is limited because you
Your
don't get
access is limited.
So now
Mhm.
you're in networks, and luckily in the metropolitan areas, most of the doctors today participate in government programs. But if you go to
Mhm.
some other parts of the country, that's not the case. And
Right.
even 20 years ago, I remember when I started in the 90s in the business, a lot of doctors say we don't take Medicare. We don't take Medicare.
Yeah, and I
You
mean, even now, even in
Some don't, yeah.
metropolitan areas, a lot of them don't. I mean, you have centers that do, but a lot of the private doctors don't, because it's such a struggle to get paid,
Yes.
and the pay rate is low. But I think that for a lot of us, it isn't even the low rate of pay, but just the struggle to get paid, the paperwork that's
Mhm.
involved with it, and all of the monitoring that goes with it. I didn't go to medical school to spend hours of my day pushing paper around. So I think that is a lot of where physicians are pushing back on government paid medical systems is like way too much paperwork.
Well, doctor, I can add to that. I mean, I've seen recently there's a good percentage of doctors that actually are leaving their practices
Yes.
and basically just participate in the hospital system where they don't have to have any overhead
Yes.
and deal with all that.
Yeah.
They just go
Yeah.
do their stuff and walk out. That's it.
Yes.
So
Yes.
it's almost. But then now the question is, the people are not getting that access. That doctor that was out there in the private practice was able to give you more time. Now it's going to share their time with, a lot of individuals, 10 minutes, 15 minutes visit, which is not enough.
Yes.
So,
and then the other piece of that that's really important, and that became a major issue for me. I was always putting on boxing gloves and boxing with insurance companies. Because sorry, but as a physician, I have the training and I have the patient sitting in front of me, and the patient defines the medicine. The trend, especially now, is more and more towards cookbook medicine. It's evidence-based medicine, and this is what the book says, how we treat the patient. When I was coming through at Tufts, they were very, very staunch about treat the patient, not the numbers. The numbers are important, but the patient defines. The patient will tell you what's wrong. Their body will tell you what's wrong. And I still to this day adhere to that, because I can't tell you how many times I've seen doctors who, my own doctors, didn't ever touch me. It was just, let me look at the labs and so on, so forth. And, you could have another head growing out of the side of your face, and they might not necessarily know it because they're busy stuck to this computer. So it is very important to see the patient. But what happens is a primary care doctor who is outside of the system can focus on the patient in a certain way. We get caught up when we take the patient through the insurance system, and I'm looking at the patient and I know the patient needs X, Y, or Z because 30 plus years of experience have told me that. Mm-hmm. And so rather than getting the X-ray before I get the MRI, and before I do the physical therapy, I'm looking at the patient and I'm like, nope, that one's going to need an MRI, And so
you're concerned now because
right.
the insurance may or may not cover the authorization and all that stuff.
Right. And, they're going to argue with me. I'm going to have a peer-to-peer, and generally that peer-to-peer is a paid head. So he's going to say, well, no, you don't need it. And my answer to that is always on behalf of my patient. My answer to that is always the same. I am sitting here, I am looking at the patient, and my name has got to go down on the bottom of that chart for my care. So if you're wanting to refuse this test that I'm asking for, that I'm looking at this patient and seeing that my patient needs, then I want you to put your name in the chart. As a matter of fact, I am going to write your name in the chart as having refused me this test. You'd be amazed how quickly they change their minds.
Well, I don't want to sound defensive, but I'm not actually going to be defensive. But being in the insurance world, I understand that, but it depends. In the commercial world, there is that, it's a little bit more in the commercial space than the government space.
Yes,
because
definitely.
And I unfortunately, or fortunately rather, I'm more in the government, group, and therefore we do have appeals, we have stuff, but they do care, and they do eventually. Sometimes they because there's also other fraud, waste, and abuse that happens, and there's different things that they're mindful of those things, and or unnecessary treatments that may or may not be. Some doctors may prescribe, and again, depends on the situation. But you're right. We've advocated too. I'm on the sales side, so we're the ones who bring people that you're gonna get all these benefits. And when they don't get it, they call us, it's like these hey, you told me this is covered. What's going on? Oh, well, let me see what I can do. Now,
and I tell the patient, I was like, you know what? You're the consumer. So if you're having a problem with your insurance company,
the agent.
I shouldn't be the middleman boxing with your insurance company over what you deserve to have. Talk to your agent.
And that's exactly what happens. So, and we wind up like really doing the legwork, and why not? Mm-hmm. And sometimes we lose that battle because we're not clinical. So they we get overridden quickly. Like, well, you don't understand. This is the procedure, and obviously but again, like I said, I think because we are regulated, at least in my space,
Yes.
heavily by the CMS and all, you know,
Mhm.
and the DOH. So they have to meet every single thing, because if you miss that and they get ordered, like, well, you could have done this and you didn't, and that's a problem.
Exactly.
So it
Exactly.
is
That becomes a big problem.
it is. Well, so that takes us to the preventative, which you mentioned.
Yes.
You know, I think the role of primary care hasn't been highlighted enough, you know,
Right.
and at least not in the last few years that I can remember. You
Right.
know, no one's talking about, you know, what is a real primary doctor and what do they do?
Right.
I mean,
Right.
that is a big deal. And to me, that
It
is
is a big
everything.
deal.
It is
It is a
everything.
big deal.
If you can have a good preventative doctor that's gonna do preventative medicine and help you in advance of any illness and seeing things and, you know, really understand your body, and to your point, how you would work and how you can go through medicine, avoid unnecessary stuff, you will, talking about longevity, you will have a better longevity in terms of your health. I mean, not necessarily
Yes.
life, but your health will be better for a longer time.
Absolutely. Absolutely. And I mean, I think that's a very important point that you make, because people talk about longevity and they talk about anti-aging. And I always try to make that point crystal clear. I cannot promise you that I'm going to make you live longer. What I can promise you is that I will help you live healthier longer. And that's the difference, because who wants to live to be 100 if you're broken down from the time you're 70 and you're bedridden by the time you're 80, and someone is cleaning up after you from there on out? You're not able to self-care. You have no independence, and you may not be in a particularly nice situation, fully dependent on other people. Nobody wants to live like that. So is it better to live to be 100 under those circumstances, or to live to be 80? I had this wonderful patient. I believe he was 84 when he passed away. The week before he passed away, though, he had an appointment with me, and I was actually doing the aesthetic stuff on him, because he was, like I said, I think he was 84, and his girlfriend was 60. And my daddy is right at that age, and his girlfriend is a little bit older than me. So, you know, they still have lives. And so this gentleman, you know, he had a young girlfriend, so he wanted the aesthetic work done so that he looked as youthful as he could. And he didn't come in for his aesthetic appointment. And so I called him up and I was like, you know, where are you? Is everything okay? And he was like, well, no, everything's not okay. I'm just kind of hanging around the house resting because I went rock climbing and fell down the mountain. Oof. 84. And he's out rock climbing and falling down a mountain because they called him the father of anti-aging. And he actually wrote a lot of books on it and everything. And so he was very healthy in his lifestyle. He ate very well. He drank lots of water. He was out climbing mountains, and, you know, he got adequate sleep, and, you know, he was sexually active, and he was out there living life. And so up until the time he died, that was the life he lived. That's the way I want to go out. I'm sure you're at that age where you probably remember that little old motorcycle mama. Where's the beef? You know, I want to be her. I want to be Betty White. You know.
well, doctor, I can tell you, I think anyone watching and listening right now, that's really what everybody would probably be looking for.
Yes.
No one here, everybody, this is the dream, right? I want to live until the last minute and sleep and go away, right? But live a healthy life. And really, that's really, I mean, we're on the iHealth channel, iHealth radio. It is all about health and really keeping that health for as long and giving you tips and tricks and how to do that and maintain it. So really, if you do your due diligence, you can. And there's, again, we're talking about preventative now. We're going to talk a little bit more about your method, your style, and ultimately
realizing that really you are your greatest asset.
Yes.
You are your very greatest asset, and you have to invest in yourself. And you have to look at your life in terms of project management. If you are not managing your life, then you aren't going to get to the goal that you want, and that is to have a healthy, fulfilled life of balanced abundance. If you're not managing your life, you could stumble into it, but the very likelihood is that if you don't do what you need to do, once you get over that hill, it's going to go bad. It's going to go badly for you.
And we see that. I mean, there are a lot of folks, and I actually see it all the time, because again,
Yes.
being that
Oh, yeah.
in the senior market, I go to
Yes.
senior centers a lot, daycares, and I've also been to nursing homes and things, and I've seen both
Right.
sides where people are totally like decimated and their bodies are giving up. And then
Yes.
there's the same age group, and they're so, like vibrant with life and energetic, and they're just like dancing, kicking it, making it happen.
Yes.
And, they're still fresh. I mean, you name it. I mean, it's amazing. Like, you can see the contrast, but it's all about lifestyle, mindset, and how you manage your health. And again,
Absolutely.
preventative is key. And again,
Exactly.
doctors can make a difference. I mean, I have awesome doctor personally, my primary doctor.
Yes.
He does my workout, to see my DNA stuff 10 years from now, and he can tell you a little bit more about your stuff, what you need to do. And he gives you that, and I don't need to see a specialist. And that's the other thing. Most people sometimes, I got a pain, let me see a specialist.
Exactly.
I mean, yes, you can see a specialist. By the way, there's nothing wrong with specialists. I mean, we want them, we need them. But first thing, your doctor is capable to identify whether it's really something that, and believe me, any primary doctor will tell you, we need to see a specialist if we need to need it.
Yeah. And oftentimes, I mean, your primary care doctor is going to be better at diagnosing than your specialist, because your specialist has focused in on one little area. He only has a certain amount of tools in his wheelhouse, and he hasn't put much focus outside of that area. So if you come in and you're thinking, I have chest pain, so it must be my heart, but it's really pain that's referring from your liver, your cardiologist probably isn't going to get there. He's going to know that it's not coming from your heart, but he's going to be sending you away. Whereas if you go in and you see your primary care doctor is going to do a full evaluation, and may do a physical, may do some labs, some imaging, or may just listen to you, touch you, and we can glean a tremendous amount just from that. And your primary care doctor is going to say, I think it's your liver. I think it's your pancreas. This is what we need to do. Now, you may still require a specialist, if you have gallstones, you're going to need to see a surgeon. Yep. But your primary care doctor is going to get you there, as opposed to having to go to the cardiologist, and then the cardiologist is probably going to refer you back to your primary care doctor, or the cardiologist might refer you to the surgeon, who's going to say, well, this is not surgical, so you need to go over here. And you've ping-ponged around, and it may end up that it was your appendix and is ruptured by the time you get there.
Yeah, now you're in the emergency room with
exactly.
Yeah, you're right. Exactly. And there's one more item I wanted to highlight, doctor, which is the relationship with your doctor. I mean,
crucial.
You want to have a long-term relationship with your primary, because they will know your history, they know your behavior. And don't lie to your doctors, because some people they keep secrets, like, I don't want to they're gonna see it in the work anyway. They do the labs, like, wait a minute, your things just popped up, what did you have for the last week? It could be there, but the idea is, over time, your doctors are going to know your body, they're going to know things about you that clinically that they can help you better. But if you're
I want to digress on to that point that you made about making sure that you're telling your doctors the truth. That is really, really, really important at this point in time, because more and more people are tending towards using natural natural things, whether they're essential oils or they're taking herbal preparations and supplements. And they may not be comfortable with telling their doctor they're using them. Or for example, they may be using CBD, or they may be, yeah. And they may not be comfortable telling their doctor that they're doing these things, but it is critical because your doctor may prescribe something, for example, that thins your blood, not knowing that you smoke weed and that it's already thinned. And so, the doctor's going based on, labs that he's seen, but he doesn't know that now he's giving you this blood thinner and you're going to go home and smoke weed and thin the blood even more than the blood thinner. Now you're having a major hemorrhage. And the doctor's trying to figure out why. Like, I just started you on that medication. I didn't even give you that high of a dose. Why were you such a risk for this kind of hemorrhage? Well, you haven't told your doctor the truth. Or it's kind of one of those things we joke about in medical school, but it's not funny. When it happens to you, you've got your day scheduled out, you're seeing your patients, and the patient has scheduled an appointment for their strep throat. And you've given them a 10 or 15-minute visit because after all, it's just strep throat. And then on the way out the door, the patient has his hand on the doorknob and says, "Oh, by the way, doc, about my chest pain." That's a bad day. It's a bad day.
Now you gotta go back again.
And the the patient has been sitting on this chest pain now for 2 days, but never said anything about the chest pain when he came into the office. And as a matter of fact, the doctor didn't say about my chest pain. His wife poked him in the ribs and said, "Tell the doctor about your chest pain."
I'm sorry. I'm laughing because I do that. I'm the guy who's like, my wife always comes like, "You talk too much and you always say more stuff." I'm like, "I'd rather say everything. You told me about it. Let's just say it. Let's say it. We're not gonna lose anything." I do that same with my mom. Like my mom will tell, at home, like, "I get this, I get this, I get that." When I go there, she's like looking at him like cute. I'm like, "Mom, what's up? You told me this, and I started like listing all these things. Because if I leave it up to her, we go back home. It's like, "Oh, what about this?" "Well, Mom, you didn't tell me then." I mean, that's a problem.
Exactly.
And now you have to book another appointment. Exactly. I mean, doctor has other patients.
Yeah. And I mean, it's important because that little symptom that you just kind of push aside and don't tell us about, that could be the critical symptom that tells us that something really bad is going on, that could rob you of your life, when it was something that would have been something that we could have prevented or fixed had you told us the truth.
Interesting. And really, I mean, I think that is a core value that we need to take from this discussion. People, this is our health. This is our literally wealth. And at the end of the day, if we cheat ourselves, I mean, we're not cheating anybody else but ourselves, and we're hurting ourselves.
Exactly.
I think it's important to just be as honest as you can, ask the questions. There is no bad question when you're talking to your doctor, especially your primary doctor. What's the worst case? They give you additional testing, it's fine. But then you just ease you, and also mentally, you'll be better. Because when you know, and you've gone through all the stuff and everything is good, even stress-wise, you're like, you don't have to worry. Like, because now a lot of symptoms are similar, and like, oh my God, it took to someone, a friend, oh, that could be this. Oh, that could be this. And now like, oh my God. And I know this guy who died, and now you're like, oh my God, my life is ending. Yes. Don't stress yourself unnecessarily. Do the stuff, follow the primary, directives, and do the right thing. And so now, doctor, I want to just go right, because we're actually having a good conversation. I want to maximize the hour. So let's talk about the transition. We talk about preventative, primary, and importance, but now let's take that in the context of integrative and home, doctors. What's new? What's different today? And how you guys do it? Because I know it's advanced. But I'm not going to be the one sharing. You will share with us. I think you've taken this to the next level. So let's talk about that.
Integrative medicine has really come a long way because we are doing more with gene therapies. We're doing more with stem cells. Integrative medicine has become very scientific. There are scientific societies that are actually exploring that. And I was actually on Clubhouse in a room discussing, we were talking about COVID, and the argument was about people using herbs and things like that. And someone was again saying that it was quack medicine to use these things. And then there's the argument about the actual medical establishment killing people and all of that stuff. Again, it comes down to people. Use your heads, balance. Okay, you can't be out on the extremes. But for all of those who are saying, oh well, this herbal stuff and the supplements, it's just quackery. No, it's not. If it were just quackery, the NIH wouldn't be studying it. The FDA wouldn't be looking at it to make sure that these products are safe. The FDA doesn't give approval per se on it, but there are certifying bodies that certify supplements and all. And if you are someone who is taking supplements, okay, Costco has nice cheap ones, Walmart has nice cheap ones. Pay a little more and get the certified stuff because it's been vetted to know what's in it. But no, these things aren't quackery. There's a place for them, but you should know how to use them. And people need to understand that not all physicians are well versed in this. Most actually are not, particularly if they come from my generation, because at the time when I came through, there wasn't a lot of nutrition that was taught in medical schools. There wasn't much going on in the realms of integrative kinds of stuff being taught. Now I'm happy to say that although not enough, young people who are coming through medical school system now, they are getting nutrition. They are learning to ask patients about their supplementation. They are learning what the safe supplements are to make those recommendations. So it has come a very long way. Again, we've got interesting testing going on. We're able to measure telomere lengths. Telomere is a little piece of the chromosome, and by looking at the telomere, we can tell how long a person is likely to live. Not that we can give you, the length of time that you've got. I can't tell you, well, you have 25 years from today, but I can look at that telomere and say, look,
Healthy.
Even though your age is 60, your telomeres are saying that you're already 80 or 90. You need to do something about this. So, we have a lot of tools. And one of the tools that we have is we now have nutritional testing devices that can tell us what our antioxidant status is. And, a few years back, people weren't even talking about antioxidants. Nobody even knew what an antioxidant was. But now most people have heard of antioxidants, and they've heard of things like resveratrol, and they know that it is necessary to eat fruits and vegetables, and that these things are protective against our cells. And so immune cellular health has become the big buzz and the big thing. And if you have good cellular immunity, then it bodes well for longevity. So we've come a tremendous distance. And one of the things that we've seen occur is that there's been a rise in medical fields like functional medicine. That functional medicine didn't exist a few years back. Integrative medicine, we now have the A4M and various different certifying bodies that make sure that people are well educated in these non-quote traditional types. And, we have a lot of people who are looking towards Eastern medicine, doing acupuncture,
Mhm.
and acupuncture's now been validated as, not that it needed to be validated. I mean, they've known in China like forever that it was a very valid medical form, but here in the Western world, it's now been validated as a very viable form of care.
Well, listen, I mean, you're right. You've covered a lot of grounds right now, just in terms of the level of I guess specialty within the primary world and integrative,
Mhm.
and the level of tech and access and information that you have, gone to at what level. I mean, you're talking about DNA level stuff. I mean, that and
Yes.
that's what I was referring to when I talked about my doctor. He
Yes.
does the same thing. So he goes into like a ReaCore and he can see, if you're
Mhm.
prompt to something sooner or later, and if you're doing good and all that. And that's important. Obviously, we have technology today that helps,
Right.
but applying it and
Yes.
integrating is the key. And I think there's all that now, and you're integrating along with holistic approaches and all the different,
Mhm.
and all of those are like to your point earlier. You can have pills, but you can complement, not just have pills, but there's things that you need pills
Exactly.
for. There's things that you need, natural stuff for. There's things that you might need the surgery for. But
Exactly.
understanding these things, you give people not only hope, but also a valid, value that is like, hey, we can help you with the least amount of damage. you know,
Exactly.
and that's
Exactly.
really the most important part. I mean, to our friend who, may he rest in peace and who lived to
Yes.
the 85, that's really where we want to continue living for as long as we can. And
Right.
I've seen older, I'm telling you, folks that have, they're not, maybe older in age, but they were not old in spirit or even physical,
Right.
because
Right.
they looked younger. They were a lot more energetic than some younger folks. I literally,
Right.
I've seen them doing things that, maybe I can't even do, you know,
Absolutely.
and it's
Absolutely.
amazing. But it's again taking care of themselves,
Yes.
doing all the above that you've mentioned, and
Right.
using all the what's available to them.
Right. And it's important for people to understand, because, people, we're in a fast food society. We want everything right now. We want instant gratification. And so it's like, doc, I'm sick. Can't you just give me a pill for it? I don't want to do this lifestyle management stuff. Just give me a pill for it. But I'm here to tell you that medications are not necessarily innocuous. I actually have leukemia, and I am being treated for it. But I had an event back in December where my body started destroying its own red blood cells. And so they put me on high dose prednisone, and I was on high dose prednisone for months. Prednisone's a good drug. It probably saved my life. But one of the major side effects of prednisone is that it can knock out the vessels that feed the hips. And so right now on the 4th of November, I'm looking at a bilateral hip replacement because of the prednisone. So the medications, although they may be beneficial, are not innocuous. When I was in residency, I lost a patient, a hypertensive patient, who actually ended up, he was taking ibuprofen, took too much ibuprofen, and it gave
Ever.
him an ulceration, a GI bleed, and I mean, it all went downhill quickly, and we lost him. And the man was 45 years old. And otherwise, he had some high blood pressure, he had some things going on that had put him into the hospital, but nothing that should have been fatal, aside from the fact that he had abused this medication and ended up with the GI bleed. And then eventually he ended up herniating his brain, and it just kept going downhill, and it happened quickly. So nothing is innocuous. Medications have their purpose, and particularly if you are given a medication, if your doctor tells you how to take the medication is making you feel better, more is not necessarily better. Don't, because it makes you feel better, well, let me take twice as much. Don't do that without consulting with your doctor and making sure that that's okay.
Thank you, doctor, for the advice. And that is actually powerful, because you're right. I mean, listen, we all see and watch, drug and pharma ads. And, it's certainly the medication has a purpose and it will do it. That's why it's in the market. But they tell you about 10 or 15, side effects that can take place. And we take them because, to your point, I need to fix the problem right now. And then hopefully I'll have no outcome. And if I do, I'll deal with the the adverse reaction later. But again, it saves lives. But you're right. And anything that if you don't have to prolong the use of it either. So as soon as it's time, it's done. I mean, you're good, and you move on. But again, doctors know that. I mean, ultimately they should. And again, going back to the consumer, the patient, you need to make sure you have open lines of communication with your doctors, ask the right questions, make sure you don't do something without testing. I give you, this is true from my, I had the corona and the doctor gave me two meds, give me a steroid and antibiotic. And he said, do not take the antibiotic unless your oxygen level drops below a certain percentage. So I was monitoring throughout the period. If one did the job, I don't need to take another one. And ultimately I didn't have to. So I still have the bottle, but I did, exactly what he said. And, I called the doctor eventually later on to make sure I did the follow-ups. And I asked him, did I do the right things? That you did the right thing. You didn't need it. You don't have to have it. And I'm personally one of those people that almost take medicine only if I have to. I mean, I'll do everything, supplements and, lifestyle, stuff. But if I have to, I'll do it. But not like as soon as it takes care of business, I'm out. Ibuprofen, if I take Tylenol, it'll be like one pill a day, not 6, 7, pills.
Right. When it's necessary, it's necessary. And I mean, one of the other areas where we see people that kind of abuse that situation is people come in, I don't feel good, I want an antibiotic. Again, antibiotics are there for a reason. If you have bacteria, not every cold is bacterial. As a matter of fact, the majority of them are viral. And for the majority of the things that we have, we don't need an antibiotic. And again, antibiotics can be detrimental. I lost a child at the age of 10. My little boy had liver disease, but what actually pushed him over the edge was an antibiotic that was used to control some of the enzymes from the liver. And the antibiotic caused him to bleed. And from the time he took that antibiotic, it started a cascade that 6 months later, he was gone. So, it's a common antibiotic. And people always come into the office and say, well,
amoxicillin?
Well, no, actually it was erythromycin.
Oh, okay.
And, people come in and say, give me a Z-Pack. I want a Z-Pack, because the Z-Pack is only 5 days, 2 pills the first day, 1 pill the next day. So it's easy. And everyone wants a Z-Pack. It's like, that's really cool. They work really well, but they do have side effects. And if you don't need the Z-Pack, you don't need the Z-Pack. So save the Z-Pack for when you do need it, and a Z-Pack doesn't treat everything. We have an arsenal of different antibiotics because antibiotics are specific for different things. So, you come in and you're demanding a Z-Pack because that's what you like. That doesn't necessarily mean that's what I'm going to give you, because I'm going to use my best judgment according to what you're presenting with. And it may be that you need amoxicillin instead of a Z-Pack, and you don't like amoxicillin because it gives you a yeast infection. Well, guess what? We can take care of that yeast infection. As a matter of fact, by taking probiotics, you can prevent some of the side effects that the antibiotic would have. So you can use a natural way of preventing the side effect of the traditional medicine. So again, things can work hand in hand for balance.
Doctor, I mean, I'm really smiling right now as you describe and break it down. But it's funny because unfortunately, I think social media has become an educator these days. And I think a lot of us, and guilty as charged, I would say, I mean, some of us do some research than others, I guess. But at the end of the day, we're exposed to a lot of information. Yes. And there's opinion information or misinformation, whatever you want to call it, across the board, whether it's the the pandemic, the vaccines, or antibiotics, to your point, or like even supplements. There's so much stuff. I mean, I was looking at a TikTok earlier, and I was laughing because there's a doctor who's actually doing a duet with someone who's actually talking about, I'm going to help you make this best antibiotic, and it's honey and pepper and ginger and stuff. So it's a cocktail of spices, you know. I mean, but I mean, but being presented as the antibiotic, natural antibiotic, and so he is kind of like laughing on the duet. But so just looking at that, I mean, there's so much controversy in the world of medicine today. Not medicine itself, but because the public now is all an expert.
Yes.
You know, listen, with respect, I mean, you guys go through years of medicine school, you know, and learn all the different things. And some feel the doctors go beyond that. And there's always continuing education for you guys, and, you know, conferences and up-to-date things that the majority of us would not know as listeners or viewers or just general public. I mean, maybe some of us that are related to the healthcare, we get a little bit more into it, but it doesn't matter. At the end of the day, we're still not the experts. And to your point, I would not put one-on-one. Like, I don't know what some of the side effects would be with one thing. I mean, you mentioned ibuprofen. I get it. I mean, your liver will be shut down, you know, and it's a big risk with it. But some things, you know, you don't know. Like there's a general you hear on the news. You know what you know based on what people are saying.
Exactly.
And that's a problem.
And I mean, a lot of times the drug companies put the information out there before even the doctors, and sometimes even the pharmacists have been really brought up to speed on it, because, you know, they want to get it out there to the public and get them spending their money. But, you know, you really do have to be careful with all of that. And, you know, I have a little cup that says, you know, don't mistaken your Google search for my medical diploma. And
I'm sorry that, you know, it's funny because, again, I was reading an article that Google now has certifications, you know, where you can really get a degree or diploma certification through Google for certain categories of job. Not medicine yet, but but I mean, listen, Google is a humongous or unlimited,
it's a great tool,
encyclopedia. You can get any information in there, but understanding the information, you get a partial piece.
That's a different thing. That's a different thing, because you know, as they say, sometimes a little bit of information can be a dangerous thing. And a lot of people don't have the knowledge. And that's not saying that, you know, oh, doctors are also brilliant, because I get that thrown at me all the time. Oh, well, you guys think you're all that. No, it isn't that we necessarily think we're all that. But, you know, we spent years and years gaining information to understand all of this and to be able to analyze the information. And one of the things that any good doctor knows, that any good doctor will tell you, we don't know everything. As a matter of fact, we don't know a lot. The body is complicated, and every day we're finding out new things. When I was in medical school, they told me, you know, you have to stay on top of the continuing medical education, because every 5 years, the entire paradigm is going to shift, and what we thought we knew is going to be proven wrong. Well, I would say now that it isn't every 5 years, it's every year, it's every 6 months that we find out something that we took as a standard is absolutely opposite of what we thought it to be. You know, I mean, there was a point in time where everybody said, don't eat eggs. Eggs are bad for you. Give you high cholesterol. It's terrible.
Egg whites only.
Don't eat butter. You know, don't eat butter. And now it's like, yeah, leave the oleomargarine on the shelf and you
get
know,
your butter.
Natural butter, and have an egg for breakfast. It's going to protect your system. You know, so we're learning. You know, it is practicing, because we just don't know. And the reality of it is, we will never know it all, because the body is just that complicated, and because we're each like a snowflake, individually unique. And you know, I can get a working knowledge of what the body generally should do, but I don't know what yours is going to do, because yours may do something completely off of the books. Your body did not read the book.
Listen, and you're right. We are different, and there's different things that trigger. There's genetics. There's so many things that you might not be
Mhm.
privy to, and I might not even know what my inheritance has on,
Exactly.
and what I have in my DNA from my ancestors. That could be
Exactly.
good or bad, and that's
Yes.
the part that. And if I don't know about it, I'm not certainly not sharing that with you because I don't even know what to share. And so, but doctor, I mean, literally, those are words spoken as a true expert and a true, doctor who understands, their world. And as a joke, I mean, everybody wants to be a sales expert, like I'm in sales.
Mhm.
Everybody thinks they
Right.
know how to do this, my game. And the same thing, like we learn, we have different things and there's some standard stuff, but not everybody can do it. They think they can, but they don't
Yes.
know exactly how to do it. And I'm not even comparing, we're not even compared to your expertise in terms
Right.
of terms and long years of real studying and learning and practicing. Um, so I mean, it's really awesome to hear you say that, and on behalf of you as being a doctor and the medicine in general, because that gives a
Mhm.
different level. And you're right. I mean, doctors will not just claim, oh, this is guaranteed. There's no such thing guaranteed because
Mhm.
it can be the
Yeah, the
best
first
medicine.
time guaranteed comes out of your doctor's mouth, you need to be finding another doctor. Okay.
Well, yeah, I mean, yeah, no, I've not had that experience yet, and
Yeah.
hopefully that anyone watching or listening do not, because there is no such thing as a guarantee. Because
No.
look, I mean, the vaccine today, it's working, it's not working. Some people have adverse reactions, some have nothing,
Right.
and
Right.
you can tell,
Absolutely.
we were told, the virus affects the elderly, now it affects everybody, right?
Right.
And so you're discovering as you go, and we're
Mhm.
still literally only a year and a half in, or almost 2 years now, but we haven't learned, scratch the surface on this thing yet. So
Yeah, yeah.
across
And I
all,
mean, people are polarized on both sides of the vaccine, of the medications, of this and that. People, stop fighting. We don't know, we just don't know. We're working on it. We're trying to work it out. We don't need to have the war of the roses or civil war over it, because if you're yapping on this side or you're yapping on this side, you're just bumping your gums, because we don't know. We just don't know.
I wouldn't even go there. It's a sour topic. It's very sensitive, but I think you said
Yes.
it best because there's two sides of it, and at the end of the day, there is both sides of truth, and there's the real truth, and we're still discovering
Mhm.
it. And there's a group
Figuring
of
it out.
people. There's a group of people that's in between. I mean, we understand
Mhm.
how things, but we know what science. It takes time, and
Mhm.
there's going to be enough elements that need to be in place for us to know more about it, and we will get there.
Right.
So, in the
Yeah.
meantime, it's the frustration. I think that's all.
It is frustrating. It is very frustrating.
But so, doctor, I know, I mean, listen, I can go on with you for a long time, but there are a couple items I wanted to cover on the show today. One is the sign behind you, the Empowerment Project, and also your book. So let's talk about the Empowerment Project. What is it about?
Okay, the Empowerment Project is a program that we had predominantly for women, but we do have programs for men too, that empower them to, again, as I said in the beginning, to see themselves as their greatest asset, to empower them to take control of their overall health. And we have a paradigm that I call the healthy windmill lifestyle paradigm. And we look at the emotional, the mental, the physical, financial, family, social, and spiritual. We look at all of those because every bit of it impacts on your health. There basically isn't anything in your environment that does not in some way impact on your health. So we empower people to look at that and encourage people to look at all of the different aspects. So, we put one of those letters on each of the blades of a six-bladed windmill, and then the spiritual is the base of that windmill. And we encourage people to attend to the health of each of those different facets. And if we attend to that health, then we are likely to live a very healthy, fulfilled, and balanced life. I also encourage people to understand that there is no such thing as balance. at any given point in time, we're going to have to pay more attention to one area than to another area. The important thing is that you cycle back and take care of all of the different facets of your health. And this is one of the things that the Empowerment Project does. It is a series of webinars and courses, and we also have a mastermind that helps people learn how to embrace their wellness, how to invest in themselves. And if we invest in ourselves, then we have a full well. And when we have a full well, then we're able to go out and give to the rest of the world. And, you know, my ideal, my vision is to empower purpose-driven leaders to embrace this healthy paradigm, because I, as one person, can only reach so many people. But if I am able to empower other leaders, they all have a tribe and they can reach. And by doing that, eventually I can conceivably touch just about every person in the world. And I mean, you know, right now, humanity's sick in a lot of different ways, and it needs healing. And it's going to take, you know, it takes a village to raise a child. It's going to take a village to raise humanity. And I want to be a part of that. And that's part of what the Empowerment Project is there to do. And as far as the book goes, the book is coming out the end of October-ish, actually right before I go for my surgery. So we'll have the book release party and everything before I go in for my surgery. And the book is Game Changers. And it is a collection of stories of purpose-driven leaders who are out there trying to change the game and make the world a better place. And what it is their why stories. Why do we do this? Why does it matter? And what are we trying to achieve? So I have a chapter in Game Changers, and I'm very excited about being able to share that.
Well, thank you. I mean, these are two powerful projects, I think. I mean, just the names, I mean, are powerful in themselves. I mean, you can really just get a lot just from the titles, and you know, that's great work. And you've been ahead, cutting edge, you know, in your career, and you've helped a lot of people. You still are, in different ways, directly through the practices and the innovation, also through the extra projects that you're involved with, and that is you know, something unique and commendable. And thank you for every single thing you've been doing, Doctor. It is a true honor to have you today on the show, I have to say.
Okay, and I am putting into the chat box there a phone number. Okay. Not a phone number, an email. And I did not get a chance to set up my funnel for the gift, but I do have a gift for any of your audience members who would like to receive it. And
all right. Thank you.
If they just want to shoot an email to that address and give me their name and their email and tell me that they saw me on your show, I will send them out a gift.
Well, Doctor, I appreciate that, and I know they will. I will actually share the information on the description of the show, so I'll have your I see it now. It will have all the information, your website, your contact, as well as the information right now on the screen. So I think that's great. You know, at least you know, there's something that people can take with them and learn, and they can reach out to you, right? I mean, for services as well.
Absolutely.
Through the email or through the site.
Yes,
basically.
Absolutely.
And you service a particular area, or you can do now telesale, I mean, telemedicine anywhere?
Well, again, you know, I've been ahead of the curve for a long time, and I'm so happy to see everybody else catching up.
Well, you have a team, you know.
And you know, I have been doing telemedicine for years and years. I started out doing it with the military, actually. Oh, wow. And so this wasn't new when it arrived, but it was very welcome when it got here. And because of the leukemia, I am somewhat immunocompromised, and with COVID running rampant still, you know, I'm having to pull in. But telemedicine is all the rage right now. And so I still am available on telemedicine platforms. So if you reach out, you have some healthcare needs, I am available to assist with those. I am a concierge physician, so I see patients worldwide.
Well, doctor, thank you. And that's an excellent, piece of information that, people can have access to. I mean, sometimes people do need that, and you'll take, sometimes people need a second opinion. Sometimes they just need, they
Absolutely.
may not be sure. They can reach out to someone. They know that they can reach out to you and get,
Absolutely.
the real stuff. So thank you for that. That being said, I think we've really, this is one of the longest shows I've had actually. So,
Wow.
and to be honest with you, I still want to do more, but we can do a second comeback. So just for now, I mean, because sometimes people like it's a long show, they can't listen to it all. I try to keep it, but it just, there's so much that we covered today. So that's important. And we got it out of the way and we got it in the system and we got to get out there in the air. So, so doctor, thank you for the opportunity, and it's a privilege and honor to have you. And definitely look forward to maybe a comeback, after you heal and everything's good. And
Yes.
wish you a speedy recovery.
Yeah, things are going to get a little dicey over the next few weeks.
I know you have a very positive spirit. You keeping, the energy high, and but surgery is surgery, and it's going to take some time to come back and be 100%. Right. So we wish you good luck, from here, and the best in the surgery and good results and good outcome. And so thank you, folks. Thank you for being with us today. It's been fun. Dr. Cheryl, she's just delivered here a lot of good stuff. Thank you. So we'll be seeing you tomorrow. Different show, different guest, different topic. From me, Hurricane H. Ciao for now. Bye-bye.
Bye.